so I've got sort of a back of my hand sort of like cheat sheet about what are the things to always keep in mind when talking to kids about things that are difficult or adverse. And these are the things that I always try to keep in mind. One is to know your child. Every kid, regardless of what developmental challenges and strengths they have, has their own personality, their own temperament, the ways that they react to new things and react to unexpected things. Keeping that in mind is really, really useful as we try to figure out how do I share and what do I share with my child. So that's sort of obvious, but it's a starting point. Second place is, where is your child developmentally? The way I might talk to a 4-year-old versus a 14-year-old, a 7-year-old who has autism versus a 7-year-old who has OCD, versus a 7-year-old who's got intellectual disability. Those are all different conversations that are calibrated according to the age and the developmental stage of the child. Again, these may sound really obvious, but I think they're just the things that I'm going through my mind as I'm preparing to have a conversation with family. The next thing is to take your child's lead. There's a tendency that adults have when we're anxious about something, whether it's an illness in the family or whether it's something like the current pandemic, to overshare and to share the quantity of information and the detail of information that we would want to know, rather than taking a moment to pause and say, well, what does my child want to know? What does my child need to know in order to make sense of that for him or herself? And the best way to gauge that, in addition to just knowing your kid, is to follow their lead and to answer the questions that they ask and not the next question or the question after that before it's even been asked. So answer one question at a time, answer it directly, answer it honestly, answer it with the right amount of honesty that they need